a child who is unconscious and not breathing? Okay, so you've come in, you've checked for danger, you've checked for response, you've spoken to them, and then you've pinched or you've shaken. Hello, hello? Can you open your eyes? I'm Emma, I'm a first aider. Absolutely nothing. No response at all, okay? So you've checked for danger, you've checked for response. You're now going to open the airway and check for breathing. So to open the airway, you tilt the head and lift the chin, keep supporting, and then you put your cheek above their mouth and nose so you can feel them breathing on your cheek if they were breathing. Look down the body, look, listen, feel the breath on your cheek and feel for chest movements. You do this for up to 10 seconds and you should have at least 2 breaths in that time. If you have less than 2 breaths in that time, they're not breathing. Okay? This child is not breathing. So, for a child, they don't retain oxygenated blood in their system like an adult does. An adult will retain 3 to 4 minutes worth of oxygenated blood, depending what's happened. For a child, that isn't the case, and so it's recommended that you start with 5 rescue breaths. You would tilt the head, lift the chin, hold the nose, and then you would breathe into them 5 times, and their chest should rise each time. 5 times, okay? Then what you need to do is do the chest compressions hard and fast. So heel of your hand, centre of the chest between the nipples. You're going to be looking to push by about 1/3 of the depth of their chest. You're going to do 100 to 120 beats per minute, so roughly 2 per second, and you're going to be pushing down hard and fast. So you'll be pushing down like that. 30 compressions. Haven't done 30, but you would do 30, and then back to 2 breaths. So 2 breaths and then back to 30 compressions. You will have phoned an ambulance after the first minute if you're on your own. So you'll be doing 5 breaths, 30 to 2, 30 to 2, and then you will have to leave them to get an ambulance if you haven't got anyone else to help you. Or you can phone at that point and put your phone onto speakerphone. If you are able to get hold of a defibrillator, that will give them the best chance. You would keep doing CPR the whole time. You will not stop doing the breaths and the compressions until the paramedics are there, unless the child starts coming back to life, or until you are too exhausted to carry on.